If the coronavirus pandemic hasn't given us enough reason to get a flu shot this winter, perhaps a new study by the American Heart Association actually will. According to the AHA, being infected with influenza or another flu-like illness significantly increases the chance of having a heart attack. Doctors encourage everyone to get a flu shot, but say that it is especially important for those that are considered part of the vulnerable population, such as persons in underserved communities or those with high cholesterol, obesity, or diabetes. In addition, health officials say that not only influenza, but the coronavirus can increase your risk of a cardiac event. Over the past 8 U.S. flu seasons, nearly 47% of patients hospitalized for flu had heart disease, making it the most common underlying health condition associated with flu-related complications. And we are joined by cardiologist Dr. Farah. Hopefully I pronounced your name correctly. I apologize if I didn't, but welcome to the program. We're certainly grateful for your time.
Thank you. Thank you for having me. It's a pleasure to be here.
So this, I don't know that this really comes as a shock. We're seeing so many, we've learned about so many different things that COVID-19 seems to cause in the aftermath of having that virus. And we know that every flu season, the hospitalizations seem to kind of go up and up and up every year. It's kind of gotten worse and worse. What's the best means of protecting ourselves? Is it that flu shot?
Oh, absolutely. The flu shot is incredibly important this year. It's important to take the flu shot every year, but honestly, it has never been more important than this year in 2020 because we're in the midst of a pandemic. And as you mentioned, both the flu and COVID-19 can affect the heart, and it can significantly increase people's risk of having a heart attack. So yes, flu vaccine would be very important this year. I saw
an ad, and I think it was actually this morning, that was talking about for older patients to be able to ask for a specific type of flu shot that apparently is it's a bigger dosage of the flu shot. And I was wondering if you might be able to speak to that.
As far as I know, it's not any different for older patients. It's pretty. As far as I know, it is the same formulation for everybody.
Right.
But the flu shot does prevent. It can prevent heart attack. In fact, people who skip the flu shot are at risk of having, they're 6 times higher risk of having a heart attack.
That's it's just, I guess it's just incredible that the number is, or it goes up that exponentially, just without that one shot.
Yeah, and it makes sense if you look at the science behind it. Viruses like the influenza, they trigger an enormous inflammatory response within our bodies that leads to affecting the plaque formation process within the heart arteries, which is essentially blockage formation that leads to a heart attack. Influenza acts slightly differently by actually destabilizing an already existing plaque within our heart arteries, and it can lead to rupturing of that plaque and causing a heart attack. So just a simple vaccine can stop that process and protect a person from having a heart attack. And, for people who have pre-existing condition, this is the reason why it is so important for people with pre-existing conditions like heart disease to especially pay attention and not skip the vaccine this year.
And of course, they say that the 3 big ones, obviously the high cholesterol, obesity, and diabetes. So for those folks, they definitely want to make sure that they're getting a flu shot. But even for folks, again, who don't, have any of those underlying conditions or seem to be in perfect health for the most part, that doesn't mean that they are necessarily out of the woods if they get the flu.
That is correct. Everybody should get the flu shot. There is something called twindemic that we are concerned about this year, which would be a combination of getting the flu and getting possibly COVID-19. It is possible to get infected with both, and that would not be a good thing for anyone to have to battle, which is why it's very important for everybody to get the flu vaccine. And you're right, it's not just that people who have pre-existing conditions like heart disease that are vulnerable to getting heart attack from these 2 viruses. It's actually everybody. With COVID-19, we're seeing a lot of people having heart conditions. Even those who do not have pre-existing heart conditions are getting affected. because of COVID.
My guest this morning, cardiologist Dr. Fahmi Farah. And Doctor, thank you so much for your time this morning. We certainly appreciate it. We'd love to have you back on the show.
Thank you very much for having me.